I'm Anna Yudin. I'm a doctor of clinical psychology and a fiction author, and today I want to talk about why therapy cannot fix mental illness, why therapy won't fix you like so many people these days expect it to. Which might be a little bit surprising to hear from someone who's a doctor of clinical psychology, but allow me to explain. In order to understand why therapy won't fix you, we have to look at a history of the field of therapy. The field of therapy first emerged in the Victorian era, in the 1890s, when psychoanalysis was born through titans in the field like Freud and Jung. Freud, the father of psychology, believed that we have a conscious mind and an unconscious mind. He also believed in the structure of the mind split up into the ego, superego, and id. He was a very prolific writer, so he had a lot of opinions. A lot of them have been debunked in this day and age, but a lot of them were also very groundbreaking and are still useful today, such as the concept of the unconscious. Jung was one of his followers, who I think came to surpass him. I'm personally much more of a Jungian person than a Freudian person. Jung expanded on Freud's concepts by looking at symbolism and mythology and the collective unconscious, as he called it, not just the personal unconscious, shared symbols and meaning and images that we have throughout humankind. So psychoanalysis reigned for the first few decades, and then in the 1950s came something called humanistic and existential forms of therapy. These were basically a reaction to some of the pathologizing, hierarchical nature of original psychoanalysis. The humanistic parts focused more on treating the client as the person who is the expert on their own lives, who isn't somebody that we need to, analyze and tell them everything that's wrong with them and how they don't know themselves well, like psychoanalysis in its early stages did. Existential therapy goes kind of hand in hand with humanistic therapy. It's really focused on helping the client make meaning of their lives. Again, not with the purpose of fixing them or bringing awareness necessarily to something that's unconscious. In the 1960s came systemic family therapies, and in the 1960s also arose CBT, cognitive behavioral therapy. Systemic family therapies acknowledge the relationships between different people in a system, not looking only at the individual, but also the different roles that people play in relationships with each other. Cognitive behavioral therapy, in turn, was very different from humanistic existential therapy in that it focused on cognitions, behaviors, and emotions, looking at how our thoughts influence our emotions and our behaviors, correcting distorted thoughts, behaving in more adaptive ways, regulating emotions, and CBT is now the gold standard of therapy, meaning it has been most extensively researched in scientific studies. It's considered the most evidence-based. Now, if you went to school for therapy, you probably understand that that is a myth. That actually all therapies are evidence-based, and just because some operate on concepts that aren't as tangible and easily quantifiable, such as making meaning or the unconscious, that doesn't mean they're not effective forms of therapy. But you can see from this that the field of therapy went through an evolution over the course of its short existence. It went from understanding that there's a dark side of us, there's an unconscious that must be accepted and must be brought to light, to validating a person as a human being, to acknowledging that a person is part of a system, and to correcting a person's thoughts and feelings and behaviors to be more adaptive. I was very much gung-ho for CBT in the early stages of my career. I thought that psychoanalysis was stupid. I remember when I took a class on psychodynamic therapy, I was very upfront about the fact that I was skeptical about a lot of the concepts in there, and my professor actually commended me on having a very open mind about it despite my bias. And the deeper I got into not only grad school, but also my own therapeutic experiences, the more I realized that I actually align a lot more with psychodynamic therapy, those earlier forms of therapy, because I came to realize that a lot of the interventions I was doing with clients and a lot of the interventions that I was myself doing in therapy were very cerebral, and a lot of times would just sort of pivot the problem to something else. The problem would just jump from one thing to another without ever resolving because it wasn't going deeper. For instance, in the early stages of grad school, I remember that a lot of the interventions I would do were like cognitive challenging, getting clients to sort of talk back to their inner critic. And I still think that that's a decent intervention to try if you have a powerful inner critic. But what I realized later on was that I was actually avoiding sitting with my own emotions and sitting with my clients' painful emotions. And in doing so, I wasn't truly getting at the root of the issue. And so I became somebody who self-identified as more psychodynamic. Although I still see a lot of value in CBT interventions, and I think they can be helpful in the short term, I think that they also need to be balanced out with something that causes long-term insight and progress. So the problem, I think, is that as the sciences advanced, including psychology, but also others, medicine as well, in the second half of the 20th century, we began expecting medicine to sort of solve every pathology, and we began to take a very hyper-rational, hyper-empirical approach to health and wellness that completely disregarded it and devalued the more emotional, qualitative, intangible aspects of health. It's very much reflected in the shift from how we went to calling people patients to calling them clients. Patient, in its original form, just means somebody who suffers, a sufferer, whereas a client is somebody who pays for a service. This perfectly exemplifies what I think is wrong with the way we approach mental health today, is that in therapy, we went from seeing people who come to therapy as people who are suffering, who are in need of help, to somebody who's going to pay for a service. And we see so much litigiousness, at least in the United States, against providers of all kinds of doctors and therapists, even when there wasn't any sort of recklessness or when there wasn't anything wrong done by the provider, simply because people are becoming frustrated with the notion that providers can't fix them, that not everything can be fixed. This is why I think AI will never replace doctors, because when you use AI, you see all these disclaimers about how they're not responsible for giving you accurate information and all that. Society wants somebody to blame when issues aren't resolved, when something goes wrong. There will always need to be a doctor on the other side of that, because there needs to be a person that people can blame when they don't have a quick fix. And I think scientific methods also started to prioritize therapies that gave brief periods of symptom reduction that were often followed by relapse. I mean, when you look at what evidence-based therapy means, very rarely do studies look 10 years out, 20 years out to see if that person relapsed. And insurance companies oftentimes only compensate therapists who provide such treatments that were shown to be short-term effective, because insurance wants to pay therapists as little as possible, so they want something quick that's going to fix the problem, as opposed to helping the people with insurance make more meaning, gain more insight on themselves, move through the world in a healthier way. The insurance companies don't care about that, okay? The insurance companies just want to spend as little coin as possible. But here's the harsh truth. Health is not eternal. Just like we will all eventually experience a decline in health and ultimately die, either due to acute or chronic illness, we will all also experience moments of mental anguish, sort of emotional death, as it were. In the case of mental illness, it's a little bit different from physical illness because most people won't meet our end because of it. It's not actually going to end us. And instead of clustering towards the end of our lives, mental anguish usually tends to cycle throughout our lives. We have periods of up and down. The problem is that we in modern society want a quick fix to problems that cannot be fixed, and a quick end to pain that we will have to endure no matter what. There's a difference between pain and suffering. Pain is inevitable. Suffering is when we augment our pain by resisting it, by resisting the inevitability of it. And I think so much of what is wrong with the way people approach therapy these days is they're approaching it with resistance. They're approaching it with avoidance of their struggles. They say, cure me now. I want to get rid of these symptoms. I want to feel better now. In taking that attitude, you are ironically transforming your pain into suffering, not distancing yourself from the pain. A few months ago, I read this book, Forged in Darkness, by Dr. Joanna LaPrade. Fascinating. 5-star Jungian book, all about how experiencing these periods of darkness can be analogous to traveling into the underworld of your psyche. And it uses a lot of mythology and symbolism to exemplify that point. I'd like to read a couple of sentences from this book that illustrate my point. The modern preoccupation with consistency and containment teaches us to regard contradiction as negative. We sanitize darkness, covering it for the sake of control. We think psychology is a way to be saved from the messiness of suffering, really the messiness of life. But suffering is a part of what makes us human. If we put energy into avoiding the underworld, we miss the fecundity that can help us heal and grow. We banish the ineffable in service of clarity, avoid the unexplainable in favor of what we can engage with tangibly, and neglect the symbolic for the concrete. A psychology of depth sits uneasily in the Western mind. Mainstream psychology deals with the surface, treating symptoms without diving deeply to discover their source. Yet despite repression, neglect, or quick fixes, the demand of the inner world insinuate their way into our lives, expressed as symptoms, compulsions, depression, and neuroses. Surface techniques often ignore the deeper, unknown parts of ourselves, the realm of meaning, spirituality, imagination, emotion, soul, dreams, and darkness. None of this is to say that symptoms of mental illness cannot be reduced. Whether you choose to go to therapy, taking the connection course, buying the mental health bundle, using my journaling workbooks, or any other resource, there are ways to reduce your distress and improve the impairment in functioning caused by mental illness or just mental struggles. But you have to remember that some forms of mental distress are incurable. For example, the grief that you feel when somebody you loved dies. Nothing is going to cure that except time and processing. Also, you have to remember that seeking a quick fix will only augment your distress because remember, pain times resistance equals suffering. And thirdly, mental health is more than just the absence of mental illness. Let's break this all down. Seeking a quick fix will only augment your distress. What do I mean by this? Again, anytime we want a quick fix for something, we are practicing resistance of reality. And resistance of reality is what transforms pain into suffering. For example, look at panic disorder. Panic disorder on the surface is a person who experiences panic attacks, but that's not what it is. Panic disorder is a person who is afraid of experiencing panic attacks and in doing so triggers more panic attacks. Panic disorder is basically fear about fear, resistance to fear. What about OCD? OCD is basically a fear of discomfort and a fear of uncertainty, practicing resistance towards those things. If people with OCD could acknowledge that sometimes they're going to be uncomfortable, or sometimes there's going to be uncertainty about safety, they might not meet criteria for OCD anymore. Narcissistic personality disorder is the resistance of one's own imperfection. Borderline personality disorder can be conceptualized as the resistance of the possibility of being abandoned, of being alone. You see, almost every mental health disorder and issue is not caused by the darkness that it consists of. It's caused by the resistance to the darkness. Most disorders are disorders of resistance, not of pain. But how do we define what is successful therapy and what is good mental health? One perspective is that it's the absence of mental illness. And this is kind of equivalent with the medical view, that you're healthy when you go into remission from cancer or when you bounce back from a cold. The problem with this way of defining health is that it doesn't account for incurable illnesses like autoimmune disorders, cancer that can't be beat, chronic illness. So is a person unhealthy just because they have endometriosis? Are they unhealthier than a person who has no illnesses that we know of, but also doesn't do anything to let their body and mind flourish? That doesn't quite make sense to me. What do you think? Alternative perspective is that mental health is not just the absence of illness, but rather a life filled with meaning, with joy, gratitude, flow, beauty. That's why all of the prompts in A Season of Life are meant to evoke more of these things, because it's not just about surviving, it's about flourishing. Mental health is also about having quality relationships, healthy interpersonal patterns, a life filled with connection. Also about having self-compassion, having compassion for other people, having a sense of self-efficacy, like you can accomplish the things you set out to do, having the ability to get back up after a period of hardship, resilience, having authenticity, feeling aligned with your values, having self-awareness, treating yourself and others kindly. In this way of defining mental health, a person could still meet criteria for a mental health diagnosis or have symptoms of something, and they would still be healthy. Just because they struggle with a mental illness doesn't mean they're unhealthy. Viewing things in this way can be inclusive of the person living with bipolar disorder, who may always need to keep an eye out for periods of depression or mania their whole life, or the person who experienced trauma and still manages to have a fulfilling life, or people with a diagnosis that can't be cured, like something neurodevelopmental, something neurodegenerative. After all, which of these two people are healthier? A person with ADHD who's trying to live a full life, or someone who doesn't meet criteria for any disorder, but has none of the characteristics I just mentioned of somebody who flourishes? This is why most therapists don't aim to cure clients anymore, because curing symptoms, no longer meeting criteria for a diagnosis, is not the whole point. It's not what health is. And here's another way that physical health is different from mental health and why we can't really take a purely quantitative medical approach with it. A physician can to some degree manipulate the elements of the body, the muscles, the bones, the skin, the blood vessels, the organs, including the brain. But a therapist cannot directly manipulate the elements of the psyche. The thoughts, the feelings, the behaviors, the motivations, attention, perception, defense mechanisms. A neurologist works on the tangible aspects of the brain, but a therapist works on the abstract aspects of the mind. The brain and the mind are two different things. The only person who can directly control and manipulate their mind is the person to who the mind belongs. A therapist can only use certain interventions that maybe indirectly help a person to do that. But at the end of the day, it's up to the sufferer, the patient themselves, to take actions that will change the way their mental health works, that will change the way their mind works. Call it willpower, call it personal responsibility, call it consciousness, the spirit, the soul, whatever you want to call it. Only that person can really heal their mind. Let me give you an example. What do you think this person's chances of healing are? Somebody with depression goes to a therapist. They smirk at the interventions. They don't do the homework. They don't reflect on the insights gleaned. They don't try to pay attention to new things. They don't try to take part in new behaviors or new ways of thinking or responding to their feelings. Do you think their chances are very strong? No, because the onus is on them to directly change the way their mental health works. And in refusing to do so and saying, well, my therapist is going to fix me, it's not going to fix anything. You have to fix you. Does this mean that therapy is pointless? Absolutely not. Studies show that all of the main accepted therapies, all of the types of therapy I described, are better than placebo and have similar effectiveness overall, though some are effective for different things. The common feature of what works in therapy is the relationship between the patient and the therapist. Somebody who walks with you in your underworld, cares about what happens to you, who makes you feel like you matter, who teaches you better relational patterns, who you can trust even with the darkest parts of you. This is different from any other relationship because it's a one-sided focus on you, accompanied by evidence-based interventions and psychoeducation and skills that can help you and emotional processing by somebody who's trained to be sensitive, who has very specific boundaries that they're willing to uphold, who's somewhat objective because they don't know anybody else in your life. It doesn't feel like you're being burdensome because it's literally their job. They get fair compensation for the work that they do. So this is a very special relationship that you can't just get anywhere else. Therapy can be very valuable. All I'm trying to say here is that you cannot go into therapy expecting a quick fix. You cannot expect to never experience mental anguish in your life. Some types of mental anguish are here to stay and you can live with them and manage them and even flourish despite them. Everything in life is about polarity and cycles. Everything in life is going to be about cycling between light and darkness, cycling between moments of flourishing and moments of distress, of underworlding, of diving into the unconscious and into the dark parts of you. And that is normal. And the more you will resist those dark parts of you, the stronger they will get, because the more you're turning your pain into suffering. I hope this made sense. Let me know what you thought. Don't forget to check out the mental health bundle while you still can, and I'll see you soon.